Welcome to Broad Eye, the podcast that explores knowledge gaps in ophthalmology and eye care. Hello, everyone, and welcome to another episode of the Broad Eye podcast. My name is Sean Maloney, and today I am here with a very special guest, Ashley Alexander. Ashley is a certified ophthalmic technician, and she's special in many ways, in part because I think this is the only episode I've ever recorded on a weekend. So Ashley, welcome to the show.
Thank you so much for having me. I'm very excited to be speaking with you today.
Great. So I think most people in the field have heard of ophthalmic technicians or technologists, and there's some different certifications out there. So I was hoping that maybe we could start off by just touching on the ophthalmic technician certification program and what that looks like for people who might be interested.
Sure. So the certifying body of allied ophthalmic personnel is actually offered through IJCOPO, which is the International Joint Commission of Allied Health Personnel in Ophthalmology. It's a long name. And they offer several different certifications, but their core certifications are the Certified Ophthalmic Assistant, which is the entry-level position, Certified Ophthalmic Technicians, and then the Certified Ophthalmic Medical Technologist, which is kind of the top tier of training within ophthalmic personnel. So applicants are tested and expected to have knowledge in a variety of content areas. So they're tested on the different clinical and personnel functions within eye care, the different subspecialties within ophthalmology, ocular anatomy and physiology, safe practices within the clinic. Various skills are taught, such as conducting patient assessments, such as history taking, visual acuity testing, slit lamp biomicroscopy, tonometry, lensometry, visual field testing. So a lot of the specialized testing required by ophthalmologists to kind of complement their physical exam of the patient. Applicants are also tested on their knowledge of clinical optics, surgical assisting, so a huge variety of different content areas. And there are different ways that one can become eligible to write these exams and gain these certifications. Number of years of work experience is one of them, but the one way that I can truly speak to, and that I think is a really important way of gaining certification, is the eligibility through a formalized training program, an accredited training program. And one of the benefits of a training program is eligibility to write these certifications without having any prior work experience, but really the true benefit is the opportunity for a higher quality of eye care for the community. Accredited programs set this standard of care, and studies have actually shown that employing educated, trained, and qualified professionals actually contribute to the efficiency and quality of an ophthalmology practice. There was actually a study published in 2011 in the Canadian Journal of Ophthalmology, and 82% of ophthalmologists stated that allied ophthalmic personnel added more value to their practice, and the training of qualified ophthalmic medical personnel is actually very much needed by ophthalmologists, and that the overall productivity of their practice actually improves by having these well-trained certified staff.
Okay, so you alluded to some of the training that you have to do in your program, which is certainly covers a lot of domains. I was hoping to use that maybe as a springboard to talk a little bit about some of the tests that you do in the clinic on a regular basis. So maybe you can highlight some of the different tests and exams you'll do with patients, and what's involved in those tests, and what's the utility of those.
Absolutely. So we are pretty much involved in that initial assessment of the patient for the ophthalmologist. So we conduct the patient workup, which is obtaining a history of their present illness, past medical history, past ocular history, family history. We measure visual acuity. We do pupil checks, tonometry, so measuring the intraocular pressure. We're also trained to do pupil examination and ocular motility testing. And outside of the exam room, exam lane, we do a lot of more specialized testing. So visual field testing, which is measuring patients' visual field and their peripheral vision, and determining if they have any blind spots or areas where they're not seeing properly. We also do ophthalmic photography. So that can range from anterior segment photography, imaging the front of the eye, to posterior fundus photography, intravenous fluorescein angiography we are trained to perform, as well as OCT, which is just a huge part of ophthalmology these days. And we also are trained in ophthalmic ultrasound, more at the technologist level. And that includes B-scan, which is basically a two-dimensional image of the back of the eye. We're looking at the internal structures. A lot of the time it's when the doctor can't see into the eye because of some sort of, maybe there's an opacity like a vitreous hemorrhage or a dense cataract. So we're looking behind to see if there's anything going on within the vitreous and the contour of the back of the eye. We do axial biometry for measurements for cataract surgery. And we also do electrophysiology testing as well at the higher level. So there's a huge kind of skill set, and, you know, depending on the level of training that the ophthalmic personnel has obtained, the skills kind of go along with that.
Okay, no, well, that's there's a lot involved there, so that's good. I think you give a nice overview there, but I want to touch on another set of skills, because you're highlighting we'll call them hard skills, so to speak, of the trade, but I think there's some other, call it soft skills or people skills that are needed. And I've heard different stories, and maybe you have any, or maybe have some, of when you've had to, you know, kind of take over for an ophthalmologist, explaining things to a patient about a diagnosis or what's going on, because the ophthalmologist has to, you know, move on to the next patient. Obviously, there's pressure on them to see as many patients as possible. So have you found yourself in that role before, trying to, you know, be the information giver, so to speak, because the ophthalmologist is short on time?
Oh, absolutely. And, you know, this kind of loops back to the need and the importance of well-trained and educated allied ophthalmic personnel, because patient education is so important. And within ophthalmology, you know, it's such a fast-paced, high-volume area of medicine. The ophthalmologist can't always take the time that they want to with the patient, right? And so being able to kind of fill that gap for the physician you're working with is incredibly, from my perspective, I find it incredibly fulfilling and rewarding to be able to offer that to the patient. You know, a lot of times a patient will come away from an examination with the doctor and have lots of questions after they leave the room. And you being there, able to answer their questions, whether it's about their eye drops, whether it's about, you know, what exactly, you know, what is glaucoma and why is it so important that I take my eye drops? You know, maybe you're seeing them for a specific test, and they want to understand, why do I have to do this visual field test again? You know, I did it 3 months ago. Why are you making me do it again? So I think it's just really important to be able to educate our patients so that they can, you know, really better care for themselves and their overall eye care, eye health. And, you know, I think it benefits a practice greatly to have allied health personnel that can fill this void. You know, the clinic that I'm working in right now, we have ophthalmic scribes. And actually, it wasn't until I joined a private practice that I really had experience with ophthalmic scribes. It's a pretty big area in the States. Lots of clinics utilize that, but in Canada, not so much that I've seen. But scribes really kind of take over once the physician leaves the room. You know, they're explaining the drops, they're explaining any appointments they have to set up, surgical signups, you know, just even ordering blood requisitions and MRI, CTs, getting all those, you know, moving for the patient. It's a really important role to the eye care and the healthcare and overall well-being of the patient, really.
No, so that's, you know, I want to maybe put a pin in that concept of working in a private practice. We can come back to that a little bit later, but I wanted to also, dive a little deeper into the art of your job, because I feel like it's not something that everybody can do. It's not as simple as, okay, hey, you can do these, or not that everybody could do well. It's not as simple as, hey, can I do these different tests and explain the results and everything to patients? I've heard some stories, and we've talked previously, maybe we can share one or two of those stories of how the job can be a bit more of an art than a science sometimes, especially when you're dealing with patients with any kind of special needs, right? It's not as simple as, the ophthalmologist says, hey, Ashley, go and perform this visual field or this OCT. And it's not that every patient that walks through is a robot and is either A, compliant, or B, able to easily comply. So maybe you can talk to that a little bit if you don't mind.
Yeah, for sure. So certainly there are times where you've kind of found yourself in a situation that you have to perform a particular test on a person that, may not be completely suitable for that particular test. So an example may be, a visual field on an Alzheimer's patient. Visual field testing requires patient cooperation. It requires patient input. The patient is asked to maintain a fixation point. They have to understand to press a button each time they think they see a flash. They have to understand, that they must blink normally, but not look around for the different lights. So, you can understand how if a patient has some sort of cognitive disability in any way, that could be quite difficult. And, sometimes I think, with ophthalmology being so high volume, fast paced, you can kind of go into autopilot mode and obviously having visual fields is very, very important and helpful for diagnosis, but not always obtainable. So you have to try to, just work with what you can get in a lot of ways. Also, just, part of the art is learning to gauge types of personalities, so learning that, the patient that you're sitting across from is that person that needs more explanation. They want to know what's going on with their eye. They want to know absolutely every step you're taking throughout this particular test. And it helps them feel more at ease. It helps them be more confident in your skills and knowing that they're, receiving great care. Where some other patients, they may be anxious. They may do better not really knowing the nitty gritty and fine details of what we're going to be doing today. I mean, for example, one of the tests that we perform, a UBM, which is an anterior segment ultrasound, it's probably one of the more, I say, invasive tests, not really invasive, but it requires a lot of patient cooperation in that we lay the patient back, we put a drop of freezing in their eye, we place a shell on their eye, and we fill that with a sterile saline solution. We put a probe in that is oscillating rapidly. And this is all while they're awake. And it can be a little bit unsettling for a patient to kind of have a cup of water sitting on their eye while, having a probe right in front of their eye rapidly oscillating. Like it can be a little bit, intimidating and scary. So, maybe not giving a ton of detail about the procedure you're going to perform for those patients that are squeamish. But also recognizing that there are patients that are going to do much better if you explain to them absolutely every step of the way. So, it's just through time and experience that you're able to kind of gauge those personalities and really just learn how to, do your job in the most efficient and most the easiest way that you can for yourself and the patient.
Yeah, I think you did a pretty good job of making that sound like a sci-fi horror experience.
I know. Whenever I explain the test, the patient looks back at you with their eyes just wide open, like, you're gonna do what?
Yeah, sometimes you're better off knowing sometimes, right? So I had an experience like that at the dentist once, and they're, just a basic procedure, and having them asked them to kind of explain all the steps. I'm like thinking like, man, they're doing a lot of stuff here. I just better close back. And they have one of these TVs in the ceiling. It's like, I'll just close back, lay back and look at the ceiling and just let them do their thing. So
Exactly.
So you've previously worked in a low vision clinic, and I'm
Mm-hmm.
wondering if A, was that part of your ophthalmic technician training, and B, is it something that you feel that you've taken some knowledge or perspective away from and can use that to better function in your current role?
Absolutely. I mean, so to answer your first question, low vision training wasn't a large part of my my training program at the time that I took it. But I was actually fortunate to become closely involved with the development of the vision rehabilitation clinic at the Kingston Health Sciences Center during my first year of working after graduating my program. Dr. Mark Bona of the Department of Queen's Ophthalmology really recognized the dire need for an integrated system and area for individuals with vision loss that focuses, on safety, independence, and quality of life. So he started a small low vision clinic, and it was small. It was just me and him, really. I would perform the microperimetry testing with the patient. Dr. Bona would conduct the assessment afterwards. And as the clinic became more and more established, Dr. Bona and I developed more of a role for the ophthalmic technologist in the visual assessment of a low vision patient. So, besides performing the microperimetry, we would, do a manifest refraction, make sure that, is this patient really seeing the best that they can actually see? We would test their visual acuity using an ETDRS chart. We do contrast sensitivity training, testing, and we would also do different tests in terms of how lighting can affect their quality of vision. And being involved in that low vision clinic was just such a contrast to where I was submerged in my training in that high-paced, fast environment, from the 80-person AMD clinic, going down to only seeing maybe 4 patients in an afternoon, because you're doing more of that psychosocial aspect of these eye diseases and how they're affecting a person's well-being, their everyday tasks of living, and how they're affecting their personal relationships with their family and friends. I think it really helped me to develop more empathy. I think it taught me to be able to have more difficult conversations with the patients and to really get insight into their daily lives and how vision loss is really affecting them, affecting their friends, their family. It is really, I think, was a really critical part of my training outside of my training program. I think it was a great experience, and I'm proud to have been a part of it, and everything that it's becoming. I sit back and watch, and it's wonderful to see. So I think that low vision is it's an area that doesn't have enough attention to it. And the fact that Dr. Bona is working to shed some light on that area is really inspiring, and I'm just happy to have been a part of it.
And you touch on something that like the whole psychosocial aspect and how low vision is affecting patients. I've heard this from other guests and other friends as well who work in this space, and just that these ophthalmologists who oftentimes the low vision training is not a major focus of their academic and clinical training. And I've heard certain people express, so we have a mutual friend, I won't name her at this point, a mutual friend who is a future guest, but she's mentioned to me before that I'm there to treat the eye, but once the person reaches a certain point and I can't do too much more, I mean, I don't know what to do. Like, hey, go to the low vision clinic or whatnot. I think having that experience and of dealing with that psychosocial aspect allows someone to probably better treat the patient overall, and not just the disease, right? So definitely,
Yeah.
I think it's something that more attention should be brought to.
Yeah, I mean, well, just a little anecdote to that. I mean, I remember one of my first patients that I'm not going to say I became close with, but really affected me and made an impression on me. She was legally blind and only ate foods out of cans because she didn't know how to cook for herself with her vision loss. And, you know, that just really stuck with me, like thinking every day, just the fact that she could only operate a can opener and the microwave. That just really drives home, like, oh my goodness, treating the eye, yes, is one part of it, but there's just a huge other part to it, right? And like, what is life after vision loss?
No, for sure. And listen, I live that on a daily basis as well, so
Yeah.
I can certainly relate to that.
Yeah.
And I want to go back to something that we put a pin in earlier, so to speak, about private practice. So you used to work in a clinic, in a hospital, I believe, and then migrated to private practice. And you alluded to at least one difference of working in a private practice, and that is the availability of these ophthalmic scribes, at least in some practices. I was wondering if there's anything else you want to share, or anything, any insights on the benefits or drawbacks of working in private practice.
Yeah, absolutely. So I did work for 8 years in a hospital setting. It was an incredible experience to be a part of an organization, a department of ophthalmology with all the different subspecialties. Moving to private practice, I've noticed, you have much more autonomy. You're able to shake up certain processes and try things a different way to try to make things more efficient, to maybe make the patient care experience better. And you're able to do that pretty much immediately with having to go through so much red tape. You decide one day you want to try something, and you work towards implementing it the very next day. Whereas when you're part of a larger organization, unfortunately, it's just not that easy. You're having to pitch your ideas to a board of directors maybe that don't have experience within ophthalmology, and you're trying to explain to them why this change would be so important, and just gaining that permission and to move forward just takes time. And for myself, I found that a little bit frustrating, and I was drawn to there must be an easier way to make change. And being in the private practice, I've been there almost a year now, and it's been incredible. It's being able to bring forth ideas right away, making just small changes that impact in a huge way. And especially too, it was strange moving to a whole different type of system in light of COVID as well. I mean, maybe one of the drawbacks could be, limitations of resources being more accessible. When you're part of a larger organization, you have access to a few more resources. The other thing that I've really noticed since moving to private practice, which, I think I took for granted being in the hospital, was the collaboration among subspecialties, right? So, I mean, in a private practice, a lot of the time you don't have that broad range of subspecialties under your roof. Where in the hospital, you could walk down the hall and ask for that retinal opinion or ask for that plastics opinion regarding, a patient you were just examining for glaucoma. So it can be a little more, streamlined that way. And that is certainly something that, I wouldn't say is a roadblock, but it's a little bit different. But I think that's probably one of the only drawbacks I'm seeing really right now. I'm really enjoying my time in private practice, and looking forward to more years of experience in it.
It sounds like the kind of an ideal combination would be, some of the agility and, freedom of operation a little bit within a private practice, combined with the access to the resources and subspecialties and whatnot that are often found within the same in a given hospital. Somehow put all that together, and it seems like you kind of get the best of both worlds, right?
Absolutely. And I mean, technology is making that easier and easier. And I think that's one of the things that COVID really shed a light on too, was all these technology advances and how, we're able to provide actually quite good care through that, and being connected to the different areas. Much better now.
Well, I think, there's been a lot of telemedicine happening, and I think one of our future guests is actually going to be talking to that point about telemedicine in ophthalmology. So, listen, this has been a lot of fun for me, Ashley. I certainly appreciate you taking the time to speak with me, and I've definitely learned something about the role of an ophthalmic technician. I certainly had a little bit of insight into the intricacies from previous conversations with you and others. But I hope the audience certainly takes something away from this. So I just wanted to take the opportunity to thank you for joining me today.
Yeah, no, thank you. I hope I was able to kind of shed a bit more light on our profession and the importance, at least I think how important it is, and how it complements a practice and organization in healthcare to have, allied ophthalmic personnel as part of your team, as a collaborative member of your team, to try to keep trying to close those gaps and improve patient care.
Excellent. No, for sure. I think that's exactly, and that's what we're trying to do with the podcast, is kind of bridge that knowledge gap. And I think a good part of what you're doing in your role is kind of bridging that gap that exists in the clinical side. So thanks again for joining me today.
Thank you so much.
And that concludes today's episode of the Broad Eye Podcast. If you enjoyed this episode, please be sure to subscribe on your favorite podcast platform. Of course, ratings and reviews are always welcome. And you can certainly share this episode with any of your colleagues or friends who might enjoy it. Thanks for listening.